Utahns are coming together for the Steps Against Melanoma Walk to support and fight against cancer, celebrate survivors, and honor those lost to disease.
Joining us now for the sponsored interview is Dr. Tanya Bowles, an oncology surgeon for Intermountain Health who specializes in treating melanoma and skin cancer patients. And Dr. Bowles, we have talked many times about how Utah particularly have to pay close attention to the sun and to skin cancer.
Right. Every Utahn is at higher risk for skin cancer because of the elevation that most of our cities are at. And we have a lot of fair-skinned people in our population, but it's not just fair skin. We, throughout our population, see a higher risk of skin cancer in all Utahns.
And you say this is a skin cancer that can almost always be cured if it's found and treated early. So what do you tell people? When is it time to go and get checked?
Yeah, because most Utahns are at higher risk, getting a yearly skin exam for most Utahns is recommended. Your family practitioner may do that, or seeing a dermatologist specifically. And also, if you have any family history of skin cancer or you've had any abnormal skin spot removed, those people need to be seen even more frequently.
Utah is the nation's highest rate for melanoma skin cancer. I just got checked. I feel peace of mind. I mean, this is prevention at its best.
Absolutely. It's easy to get a quick skin exam to find things early. And in Utah, we see the highest incidence in the country, as you mentioned. Melanoma is the most dangerous skin cancer. It starts on the skin, but it can move internally, and it can be a threat to life if it's more advanced.
Let's talk about some of the best ways to prevent. And we're talking year-round, not just being outdoorsy in the summer, but even skiing.
Correct. It is a year-round issue in Utah. We have a lot of blue sky days, a lot of sunny days, even in the winter. So wearing sunscreen and SPF of 30 or higher is recommended, and using clothes to protect your skin. You know, wearing a swim shirt instead of a two-piece swimsuit, wearing a hat when you're golfing. These kind of things over time make a big difference.
We also have to remember skin cancer is cumulative. So when you're a little girl, boy, and then all the way as you grow up, this is cancer in the sun exposure as it continues and it does accumulate. What would you say to folks who see maybe a spot? What are we looking for?
So most skin cancers stand out from your normal pattern of spots or freckles on your skin. Skin cancers don't sit still. We call them ugly ducklings. Melanomas tend to be brown or very black. Not all of them. Some are red or pink, but they change over time. They don't look like anything else on your skin. So looking for a spot that's changing in color, that's getting a lot bigger. Sometimes patients will tell us the spot itched or it bled. That's a sign it needs to be checked. The edges of the spot, if you have a very circular mole that hasn't changed, it's not of worry. But if the edges start to get more jagged, or it was a flat mole that became a rounded spot, those are some of the things we're going to watch for.
And sometimes doctors see things that we can't, we might miss.
Right. Most melanoma and other skin cancers occur where the sun hits our skin, but we get a lot of sun on our back, on our shoulders, on the back of the legs. So having a doctor or a physician's assistant or nurse practitioner look at all of you once or twice a year is a big help.
And they come in with a specific magnified device, so they can really get in there. A lot of times I hear, oh, I thought it was a pimple, but it turns out it was skin cancer.
Right, and a good rule of thumb there is if you have a new spot on your skin that looks like a pimple, but it doesn't go away within about a month, it should be checked, because skin cancer, especially the non-melanoma skin cancers, can look like that.
And don't ignore it. If you see something and you think, oh, that's new, don't just brush it aside. Go and just have that peace of mind. So this Saturday morning, September 16th, 8 a.m., Golden Hills Park in Cottonwood Heights is the 7th annual Steps Against Melanoma Walk. Tell us about it.
Yes, please come out and support. It's about community getting together. It's about raising money to end melanoma. We need research to fight melanoma. We need patient support for patients and their families. And Aim at Melanoma is a nonprofit that helps sponsor the walk. We're going to come together. We're going to raise awareness. We're going to raise money to end melanoma.
Skin cancer is preventable. Dr. Bowles, thank you so much. All of that information, a line by line, a rundown of what's happening that day is on your screen right now. If you want to sign up, we have a link as well, and hashtag #EndMelanoma right there on your screen. Thank you again,
Thank
Doctor.
you very much. Really appreciate it.
Thanks again to Intermountain Health for sponsoring this interview and being a sponsor of the show today.